The timeline has shifted, so let's start here. The 45 to 54 group, they've been pushed up by 3 days to March 19th. But the biggest change is this. 16 to 44 have all been lumped together. The younger population now gets to go about a month early on April 5th.
Connecticut remains one of the top states in the country when it comes to getting residents vaccinated. And now we're taking the biggest step yet.
Over the course of the next month, I think you're going to find everybody has vaccines and appointments available to them.
When considering there are 477,000 people in the 45 to 54 age group and then 1.3 million in the 16 to 44 age range, this is ambitious. But there's a nuance to these numbers that we just haven't seen before.
Everybody in these age groups, maybe 20% of them have already been vaccinated. We vaccinated all of our healthcare workers. As you know, we vaccinated most of our educators.
The lofty goal also gets a boost by a surge in shipments.
6 weeks ago, we had, less than 50,000 doses, so we'll be up at 200,000 doses a week very soon.
With that forecast less than a month away, state officials believe we could see supply outpace demand before June.
I think you're going to find, by mid-May, we're going to be going out trying to convince people that they ought to come in and get vaccinated.
When April 5th actually rolls around, there are concerns that we may see the same bottlenecks we've experienced in previous tiers. The state has increased bandwidth for its scheduling website and has more people answering the phones, so the time between making the appointment and actually getting your dose shouldn't be too long.
By the time we get to the end of April, early May, most everyone in Connecticut who's eager to get access and to get vaccinated should have that opportunity.
Doctors agree.
We're prepared at Hartford HealthCare, and I know Yale is for a fact as well, to upscale significantly to facilitate this.
Now, one thing that's not changing is the foundation of our rollout. It will remain based on age. Those with comorbidities will not see a higher priority, but the state is delegating this to doctors, so there is an expectation that you can work with your healthcare provider to schedule an appointment in those first few weeks of April. Live here in studio, Matthew Campbell, Channel 13 News.